Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How you doing today?
I'm doing well. I won't be breathing, squeaking, making noises, writing with my pen.
Oh, you're so cute.
So, how are you?
I'm living it up. What do you think we should talk about today?
I think we should talk about helping people heal from orthopedic issues with regenerative medicine.
I love that. You got the nail on the head. So the whole idea that Nita's talking about is called regenerative medicine. And regenerative medicine is a type of medicine I've been doing for more than 25 years, since my residency at UCLA, when I was healed overnight by an injection to my wrist with, guess what? Not a steroid shot, just a little bit of regenerative medicine that healed up the ligaments. I thought I had to have a surgery, but that healed it up, and then I injected my shoulder and healed that up, and then I started doing it on my patients and have been healing patients for over 25 years without surgery. I'd love doing orthopedic surgery, but I found that it caused more problems than it helped. I know there's a lot of times it is needed, and we do need the orthopedic surgeons. Don't get me wrong. They do some of the toughest work in medicine, so God bless you, orthopedic surgeons. It's just that, unfortunately, there's too many surgeries being done that don't need to be done. I'm going to give out the phone number. We can get some callers in. Give me a call right now. You can talk to me and ask questions about your musculoskeletal pain or your family, friends, whatever it is, and we can hopefully help them get healed without having a surgery. So the phone number of the studio right now, get a pencil or write it down, 866-870-5752, 866-870-5752. And if you want to get a hold of my staff at the office right now, there's people by the phones. You can get more information than we might happen to talk about on the show. And the number to the office is 800-300-9300. That's 800-300-9300. For those of you on a computer, you can look at my website and watch me doing videos of these procedures all over the body. I just don't inject necks or backs or knees or hips or shoulders. I do the whole body, toes and muscle tears and ligament sprains, you name it. So wherever you're hurting, I typically can help. Not everybody. I've got to choose the patients wisely, pick people that I think are going to heal. And every once in a while, unfortunately, I have someone who comes in that I cannot help, and it makes me sad to turn them away. One of the biggest issues I have is sometimes people come in who are so overweight that they can't even get out of their wheelchair. They can't move their joints. And I have to send them somewhere else to get thin and before they can come back. And sometimes they get mad at me for that. And I apologize to all of you, but I can't heal everybody. And, for people that are severely overweight, morbidly obese, you've got to take that into your own hands and maybe get on a ketogenic diet or something, get off your carbs and eat smaller portions. And then when you come back, I can help you. So once again, the website is www.lastemcells.com, www.lastemcells.com. Every page on the website has a spot to email me. Yeah, you can get a hold of me. I answer emails all day, all night long from all over the world. But if you want to talk to me live right now, I would love that and make the show interesting at 866-870-5752. So, Nita, do you mind if I go to a question right now before we get some callers in here? We have a caller.
We
got Bill. Bill from Hermosa Beach, Dr. Marc Darrow, you have a knee issue. Tell me about it. How long has it been there?
Hello, doctor. Maybe a couple months. I already got my MRI printout. It says a medial femoral condyle insufficiency fracture.
Okay. So the medial femoral, I call it femoral, you call it femoral, same thing, is the femur is the thigh bone. Okay, so the medial part is the middle part. Read the rest of it, the medial femoral condyle.
Yeah, it says the medial femoral condyle insufficiency fracture.
Okay. So are you a runner, or do you do a lot of jumping or something?
I'm pretty active. I do a lot of surfing. I've
Good.
been active my whole life.
Okay, terrific.
So I don't do any type of running or jogging. Just
All right.
surfing maybe and other activities.
Sure. Well, surfing is a pretty ballistic sport. I used to do it. I did it most of my life. I lived in Hawaii and surfed some big waves on the North Shore. Not because I wanted to, because I got stuck in them. You know what happens sometimes. You get an outside set. And I almost drowned out there a few times, and I don't know how I made it out. You've probably been in the same situation.
Yeah, it's tough. It can be tough out there for sure.
It can be really tough, and people don't understand that Hawaiian waves are different than waves that we have in California.
Absolutely. You get caught, and you definitely take a beating out there. It's a little scary at times.
The waves on the North Shore of Oahu are so fast, and they're so thick that once you go under, you're held under for a very, very long period of time. And I was just texting.
Yeah, that's definitely scary. I've been there a few times.
I was just texting my daughter's boyfriend, who's there right now surfing the North Shore, and he said it's quieted down. But last week when he was there, he said the waves were huge, and he sent me some videos. And so I started he mentioned an old-time surfer and board surfer, and so I looked him up, and it talked about his wipeout. And then I started looking at wipeouts and these stories of people who actually drowned and then were brought back to life. It's really scary. It's a scary sport when you're
it is. I mean,
Hawaii.
where I surf, there tend to be some big waves and you get held under, and that's probably the scariest part about surfing. But I love it. It's my passion, and I don't want to stop yet.
No, I don't think you should stop. Believe me. The only reason I stopped is I had a great white experience off of Will Rogers Park about a mile offshore, and a giant came up next to me. I'd always surfed with sharks. I mean, they're all over Hawaii, but they never bothered anybody. No one got bitten. But this thing was so monstrous. It was like a mini submarine that came up, and it just scared me so bad.
They're huge. They're so thick. People don't
realize
how
so
thick they are.
It's so wide. And
they're so massive. Yeah, that's just scary. Believe me.
And I just haven't. I went back in the water the next day to get back on the horse and ride it. They always say if you fall off the horse, get back on and ride it. Yeah. And all I kept doing was looking under the water, waiting for that great white to come back. So I said, that's it, I'm done. And I haven't been in the ocean since.
Yeah, I know the feeling, doctor. So let me know. I know the feeling.
Yeah. Anyway, the medial femoral condyle is a very common place for issues, and it's something that we probably can help you with. And it's something that we can regrow some of that bone probably and the cartilage around it by using stem cells and platelets mixed together. Very easy procedure to do. I've been doing that for many, many, many years. I've been told I do more than anybody on the planet. I wouldn't doubt it because I do them all day long. And I think there's good hope for you. I've got to examine you first. I want to look with my ultrasound inside the knee, see what I can see. And I use an ultrasound, not the healing ultrasound, but the one that's like a camera. You can put the probe on the tissue and look inside the body and see what's going on. So it's like getting an MRI in a sense, but you can see right away. I don't have to send you. But you have an MRI, so we know what that's all about anyway.
Yeah. Yeah, because when I went to the orthopedic guy, he said just go ahead, stay active. I mean, if it hurts too much, think about a partial knee replacement. And I kind of wanted to find other options.
Well, that's not an option you're going to love, let me tell you, because having any kind of a joint replacement can break down. And although, some people have to do it if their joint is totally smashed.
Yeah.
But most people I see that come in ready for a joint replacement don't need to get it. and we heal them up just using platelets and stem cells, PRP and stem cells.
Okay, and
So,
how many procedures are there?
say that a different way. I didn't quite get what you mean.
Pardon me?
How many procedures are there?
Yeah,
how
I mean, are there continuous shots, or how does that work?
You mean how many times would you have to be injected? Is that the question?
Yes.
Well, you start out with one, and then come back in a week or 2 weeks or so, and we'll see how you're doing.
Okay.
I can't prophesize or prognose how you will do. The only thing we know about medicine is if you give somebody a poison, they're going to die, or if you cut off their leg, they're not going to have a leg. But doctors shouldn't be telling somebody how they're going to come out down the road, because we just don't know. And in the work that I do with regenerative medicine, sometimes people heal overnight, and I've been one of them. I've had my wrist healed 50% overnight.
The pain in my knee, it's the worst is when I get out of bed in the morning and I walk maybe 5-10 steps, and it seems like a stabbing pain. It kind of eventually goes away, but it still kind of lingers throughout the day.
Okay. I think we can help you. I'd have to examine you first. I never tell anybody I can help them unless I actually touch the body and take a look and see what's going on.
Yeah, I'd like to come in and see you for sure.
How old are you, Bill?
59.
So you're still a young chicken.
Yeah, absolutely.
You got a lot of years of sports and a lot of surfing left inside of you.
Yeah,
we're going to send you a copy of my free book just for calling in.
Okay.
Anyone who calls in will get a copy of my book. It's called Stem
awesome.
Cell and Platelet Therapy: Regenerate, Don't Operate. And I'm flashing through it now. There's a picture of my son Benji, who's on about a 60-foot wave at Mavericks. What page is that on? Let's see here.
Okay, great.
Here it is. It's page 15. There's Benji Darrow, and he's on this ginormous wave. He lives at Mavericks, between Mavericks and Kauai. He likes big waves. And
that's a huge wave out in Mavericks.
He surfed the pipe on the North Shore when he was about 16. And he'd never been on the North Shore before. I took him out there. And
I've been to Hawaii. I've only surfed canoes. That's a small, weak wave. I've never been like the North Shore.
Well, you'll go sometime.
Oh yeah, absolutely.
Yeah, you got to do it, right? You can go there on a day when it's not giant. You can go and just enjoy it.
Yeah, I definitely want to hit it one of these days for sure.
Because the waves there are so crisp, even when they're small. It's a lot of fun.
Oh yeah, I know. And the water is so warm and can't beat it.
Oh my God, no wetsuit.
No, that's one thing about the tropical places. Just definitely don't have to worry about a wet.
You know, there's another picture in my book at the back somewhere of Nick Lamb, who won Mavericks competition. I don't know if you know him. I've worked on him for on and off when he gets hurt. So you'll enjoy the book.
Oh yeah, absolutely. I'm looking forward to it for sure.
Okay, and for all you guys who want to call in and get a free copy of my book, which is Stem Cell and Platelet Therapy: Regenerate, Don't Operate. Just give me a call at 866-870-5752, and I will send you out postage-free a copy of this book. It's the nice thing about the book here, Bill, is it's got about 250 studies on how regenerative medicine works and the value of it and how surgery really doesn't work. And we're in a culture of surgery. We're moving out of it and moving more into regenerative medicine. Here, I just found the pictures of Nick Lamb on page 143. And he's on, it looks like he's on, it doesn't look like a Mavericks wave here, but it's a giant wave, and he's on a real long gun. It looks like he's on about a 15-foot board to get down this thing. It's so huge. All right, man, God bless you, and stay safe, and anytime you need me, give me a call.
Thank you for your call, Bill.
And, Bill, if you want to get a hold of the office, it's 800-300-9300. Also, Bill, if you want to watch me doing these procedures, see if it's something you want to do, go to the website. It's www.lastemcells.com. You can email me through that website. Every page has a spot to email me. And there's tons and tons of videos that show this type of work and what I'm doing. All right?
Sounds good. I'm looking at these pictures of these surfer guys. My goodness.
Yeah, it's pretty crazy. It's pretty crazy. And if anybody wants to get a real thrill, go to YouTube and look up surfing wipeouts. And you won't believe what these guys go through. I mean, they're just superhuman beings. And one time, my son wanted to get his testosterone checked, which I wanted to do because I didn't know how he could do these superhuman feats. And his testosterone was 4 times normal. And that gave me an idea of why there are guys who are adrenaline junkies. They just have huge high testosterone levels. So I'm going to go to another question here.
Okay, do you want to give the phone number first?
Sure. Give me a call right now. Talk to me. Let's find out what hurts. Let's show you how you can fix it, hopefully. His number right now is 866-870-5752. You can talk to me live right now. Or if you want to call the office, there are people by the phones. That's 800-300-9300. So, hey, Nita, did you know what the Italian drummer called his 2 twin daughters?
The Italian drummer
Yeah.
called his 2 twin daughters.
Anna 1, Anna 2.
Oh, that's a good one. That's a good one. I never would have guessed.
One more for you, Anita. You ready?
Oh, I can't wait.
Hey, I don't do this. My patients send these to me.
Oh, yeah.
And then they say, torture Nita.
Do they
Okay.
really?
Yeah, of course. They love hearing you laugh.
Oh, my gosh.
So I'm not a big fan of stairs. Do you know why?
Yeah, too much stepping.
Kinda. They're always up to something.
Okay, do I get half credit for that?
I'm going to give you 100% credit and
Wow.
an A+ because you're a smart girl.
Wow. That's really very generous of you. I appreciate that.
I
Well,
know,
when
I'm
people
easy.
call today, they get your book
Free
for
copy.
free. Not
Yep,
even
free copy.
postage. I mean, just
Nope.
completely free.
That's it.
So the number then to call and get your free book and talk to Dr. Darrow is
866-870-5752. Also in the office, we do the vampire facelift, which is taking platelets and or stem cells and putting them into the face and regrowing the collagen there. And there's a chapter on that in this book. And then there's another chapter on hair regeneration to thicken up the follicles and get the hair thicker. This is a great book. I mean, I'm flashing through it now. I really love it. Of course, I wrote it.
well, it took you 5 years.
It took a long time to put this together. People don't understand how long it is. Well, this has a lot of research in it, too, which makes it even tougher. So here's a book on low back and IT band and knees. Someone asked this question that someone called in. No, someone sent. Person says, my name is Matthew. I won't say the last name. I'm 26 years old. I have severe degenerative discs in my lower back, lumbar spine from a car accident when I was 18. I have sciatic pain that shoots down from my back into my butt, extremely painful. I also have IT band syndrome in both knees, so they're constantly locking, flaring up from just walking around a store, and my knees are injury prone, especially when it comes to tearing my meniscus. Anything we can do to help? I have to examine you to let you know, but typically yes. And just information on this. Degenerative discs don't usually cause pain. So when your doctor says, I'm sorry you have back pain, and I did an MRI, and the reason is because your discs are degenerated, he's not usually telling you the right thing. It's usually the ligaments that are sprained. It's usually back sprains that cause pain, not the discs. It is possible if a disc is extruded, where it's actually sticking way out and it's broken loose, then it could be on a nerve and cause what's called a radiculopathy, or some people call it sciatica. But this guy says he's got sciatic pain, and don't believe your doctor when they call it sciatica either, that shoots down from the back to the butt. That's not usually sciatica. That's usually just what we call an enthesopathy, where the connection of the there's several things that connect at the back of the pelvis: the quadratus lumborum muscle, the thoracodorsofascia, the iliolumbar ligaments. And by the way, if you ever want to look these things up, go to Google and put the name in, and on the upper left-hand corner, click on images, and you'll see pictures or drawings of what all these things are that I'm talking about. So a lot of times we inject the low back, and that, quote, fake sciatic, it's not sciatic, pseudo-sciatic pain that shoots down to the butt goes away. And sometimes it's just the connections of the butt muscles to the pelvis, and we can inject that also and get rid of that enthesopathy. The IT band syndrome, this gentleman says it's in both knees, but typically IT band syndrome is more down the femur, not at the knee. It can be at the knee, at Gertie's tubercle, but there may be something else going on in the knees because he says they're locking, and that could be from something inside the knee. So that's why when someone calls up or emails me, I get emails from all over the world every day, and they say, I've got this or that, and I go, I've got to touch your body and examine it. I don't trust what other doctors say. They usually get an MRI or they think something else, and it doesn't tell me where the pain is being generated from. And if I'm going to fix you, I got to know where the pain is coming from and then be able to inject the platelets or stem cells right on that spot. And I can't do it from you talking to me. I've got to examine you. And it frustrates a lot of people. They go, well, I want to come in, and can I just send you an email? And I go, no, don't do it. It's not going to help me. Don't send me your MRI. Don't send me your X-ray. I need to get those at some point if you don't heal, because you could have cancer or something. I know that sounds weird, but I found it. Several times I've found terrible things when we're just looking at joint pain. Lymphomas, blebs in the lungs, all kinds of things, cancers. And so I do like to get imaging, but it doesn't really help me find the pain generator, if that makes sense to you guys.
Absolutely.
Okay, let's let me see here. Let's go to another question. All right, this is a tough one. This says spinal cord injury. So this patient says they're recovering from a spinal cord injury at a T level, that's thoracic level, would like to see if you can help me. So this is a very complex question without enough information to give any advice on it. So when I actually worked at Rancho Los Amigos Hospital in Downey, California for a couple of years, and I worked on spinal cord patient injury, with injuries, people that had thoracic or cervical or lumbar spinal cord injuries. And they're all different. It's all different for what the problem is. Very often a thoracic level person can play sports in a wheelchair, and we had in the back of Rancho Los Amigos, there was a big playing field where we had patients who had been paralyzed in the lower legs, but they could still do sports. They would play a lot of different sports, but a lot of them would get, let's say, wrist or shoulder overuse syndromes, and I would be able to inject them and heal that. But if you're asking about can I heal the spinal cord, my answer for me is no, I cannot, because that's not what I do. I do musculoskeletal work. There are doctors who are working on injecting the spinal cord with stem cells, and there is progress with that. It's more at the level of experimentation, and it's something I don't do. Maybe someday I will when I know more about it, but at this point I don't do that. I just work on the musculoskeletal system. So if you do have any issues with the spinal cord injury, and they're overuse injuries, rotator cuff tears or arthritis, things like that, then I can probably help you. Make sense, Nita?
Absolutely. I'm in.
Yep, me too. I'm in all the way.
How about that phone number?
I know. We need some callers today. It must
do.
be such a gorgeous day that people are not near their phones. 866, give me a call. It's 866-870-5752. If you're driving, I hope you pull off to the side of the road and get off your Bluetooth so we can hear you. And then if you hear the show at a different time and you want to call the office, the number there is 800-300-9300. And to go to the website, it's www.lastemcells.com. So also I didn't mention, my book has the foreword by Suzanne Summers, which is on page, it's Roman numerals, it's page 15 in Roman numerals. I had to think for a while to remember what they mean. Hang with us, folks. we're going to a break, and we'll be back in a minute or so. And I'd love if you call me up and stump me with your questions about musculoskeletal pain, joints, and tendons, ligaments. And all of you that want to get a surgery, please call me first. The number to talk to me live is 866-870-5752.
And we'll be right back after these messages.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.